for Deuk Spine Institute. I'm Dr. Ara Deukmedjian, CEO and founder, board certified neurosurgeon. Our patient today travels from Virginia. He has a herniated disc, but more importantly, he's had a prior fusion in his neck. Number 6-7 was fused several years ago, and now he's developing what most patients with fusion develop, which is adjacent segment disease, which is symptomatic adjacent joint problems, pain or neurological symptomatology coming from a joint above or below fusion. In this case, it's above the fusion. The fusion was done at C6-7. You can see the metal plate. Jordan, can you point out the metal plate? Can you guys see this, Henry?
Yes, we can.
So there's the metal plate, there's the screw heads. You guys see the screws? Screws in the vertebral body of 6 and 7.
Yes.
There's a cage in between. You can see the cage with two little eyes. And then the screw heads are somewhat proud on the plate, meaning that they maybe they backed out a millimeter or two. To me, that's not normal. They should be sunk more down. But that's the problem with hardware, folks. Number one, you get hardware failure, loosening of screws, backing out. They create problems. And then number two, we have adjacent segment disease. The disc above is now the problem. So he did not want to do another fusion on his neck. He wanted to have less invasive surgery. He's here for the Deuk laser disc repair. I've chosen to go on the left side because the other surgeon went on the right side. If I go on the right side, there will be more scar tissue, which could cause a complication. It just makes a higher chance of complication. Now that said, we've never had a complication ever with the Deuk laser disc repair surgical complication. Shot? All right, the first step is to get into the number 5-6 disc. And I'm doing that through an anterior approach. Let's go with, hold on. Let's go with a AP. I want to see where my needle tip is. He has a beautiful thin neck. It's supple. Dr. Berndes has done a perfect job. It's perfect. We're right in the center. Dr. Berndes has done a perfect job with the neuromuscular blockade to give me a very supple neck. Shot? All right, we're right in the dead center. Shot? All right, let's see on the AP view if we're still in the middle. We want to always check two views, AP lateral. If you're not sure, you can do an oblique, but AP and lateral are usually all that's necessary. We're dead center in the disc at 5-6, right above the fusion. Again, you can see the metal plate and screws. If you have questions, feel free to type them up and ask them, and my team will ask me. In the meantime, Henry, there are 30 very specific different causes of chronic neck pain. Let's show the audience the 30 causes of chronic neck pain while I gain access to the herniation in the back of this disc.
I'm Dr. Deukmedjian, CEO and founder of the Deuk Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3, next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury, to the capsule will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Deuk plasma rhizotomy is the best treatment in the world available for painful facet joints. Deuk laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain.
Welcome back. You can see the 30 different causes of neck pain, and this patient has the most common cause. 90% of neck pain, it comes from disc injuries like disc herniation or bulging disc, degenerated disc. Take a look at that x-ray. We've got the white arrow showing you the herniation. Jordan, show us the front of the disc. You guys see the front of the disc right there in the front of the spine? That's where the metal plate is too. It's sitting on the front of the spine. And it has screws into the C6, C7 vertebral body from the front to the back. Now the next disc above is the one that's adjacent segment disease. I injected dye in the middle of the disc in the nucleus pulposus, and it leaked out through the annular tear. You can see right where the arrow is, there's a little tear there, and the dye is now going around the herniation. That's why you're able to see the herniation sticking out against the nerve and spinal cord. Thank you. Take a shot. Now we've placed our dilator and our guide wire, and I'm ready to go into the disc. We've lost literally half of a drop of blood, half a drop of blood. That's all we're going to lose for the entire Deuk laser disc repair surgery at C5-C6 is half a drop of blood. We may get to a whole drop. You guys see it right here? It's right there.
Yes, we do.
There's not even a full drop of blood. So I'm placing the dilator into the disc. Now the dilator is quite special. It does not cut anything. All it does is spread. Like spreading your fingers apart, it spreads apart muscle, fascia, tendon, ligament, soft tissues. It cuts nothing. Therefore, if we're not cutting any of your tissues inside your body, we're not causing trauma. No trauma, no bleeding, no pain. The recovery is literally 1 hour, and then you're back to a normal life. The next day, people go back to work with some mild restrictions. But this surgery is so minimally invasive. It's the most minimally invasive spine surgery I know of. Shot. And I do them all, by the way. For those of you who don't know, I've done 1,000 fusions on the neck called ACDF and artificial discs combined in my career. Shot. And this is the best procedure I do on people's cervical spine for herniated discs. All right, you got the dilator at the back of the disc right inside the annular tear. That's where the herniation lives. Shot. And we're going to go back with the tube. The key is to keep the dilator ahead of the tube. If you don't do that, then you're going to be biopsying the disc. You don't want to biopsy a disc. We want to remove the herniation and debride the annular tear. To do that, I need the dilator ahead of the tube. As I advance the tube, it advances over the dilator and avoids biopsying. That's perfect. Any questions?
At this moment, no current questions.
Okay, there it is. Half a drop of blood, the whole surgery. This surgery is bloodless, and it's outpatient. There's no hospital. We've never had a surgical complication in 20 years. We've done now, this is number 2,745 Deuk laser disc repair surgeries. Right, Henry?
2,745.
Yep. And Anthony, you'll need to keep track of that when Henry's gone. All right. Let's show the audience how it is that a herniated disc can be so painful for patients. The number one cause of chronic neck pain. How is a herniated disc causing such bad neck pain? We need irrigation.
Disc injuries start with an annular tear. Damaged nucleus pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
All right, welcome back. You've seen how a disc herniation becomes painful through a process called inflammation. Your body trying to remove the herniation. And that blue stuff right there is the herniation. The white on the left and the white on the right is the annular tear. There's a piece of herniation we just released. See that? It's coming up and out. Let's show the audience how the Deuk laser disc repair works. How do we get rid of the herniation without doing a fusion? How do we get rid of the neck pain, the headaches, the cervical brachial pain? How does all that work with this simple surgery?
Disc injuries is a common cause of chronic neck pain. The inflamed annular tear causes neck pain. A 4mm skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes herniated disc fragments and debrides the posterior annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Interesting. All right, welcome back. Look at the herniation right there. See that blue thing? We've just popped out about 5 of them. These herniations are down in that tear. See the tear right here? That laser fiber at 12 o'clock is 0.5, actually 0.45 millimeters wide. Half a millimeter. That's how small this is. The tube you're looking at from side to side is 2.8 millimeters. It's very narrow. And these are all pieces of herniation. So the first thing you should appreciate is that a herniation is not one piece, it's many pieces. And I've described that for years because the only way you would know that is by doing endoscopic surgery. And so very few surgeons actually know that herniations are many pieces, not one piece. And they occur over years. There's another piece of herniation. So all these little blue, what do you call it? What do they look like, Henry? They're herniations, but
They look like little fluff balls.
little cotton balls.
Little cotton
blue
balls,
cotton
yeah,
balls.
yeah.
All right. These little blue cotton balls you see coming out. Really, there's one right there. Okay, it came out of the foramen. It was literally sitting on the spinal cord and the nerve root. And now it's come out. I've given it a path to get out. So I've taken it off the nerve that it was pinching, and I've taken it off the spinal cord. I've taken it out of the annular tear, and I'm letting it come out of the tube. I use this tube to direct it out. And that's the beauty of endoscopic surgery in the neck. Unfortunately, no other surgeon in America really knows how to do this surgery. There's only maybe 5 of us worldwide that do cervical transdiscal endoscopic surgery. Now, the first to do this were the Koreans, the South Koreans, specifically Dr. Sang-Ho Lee and his team. That's who taught me how to do it 21 years ago. I went overseas to learn from Dr. Sang-Ho Lee and Dr. Gun Choi. Dr. Sang-Ho Lee is the founder of Woodidal Hospital in Korea. They have about, 6, 7, 8 hospitals now in airports and other countries throughout Asia. And he is considered the world leader over there in Asia at pioneering endoscopic spine surgery. However, I modified the technique that I learned from him and made it better. And I added the laser. I added some other things that made it safer. And whereas the Koreans have had complications with their surgery, I have not. I've done 2,700 and this is number 45. So imagine having a surgery that fixes your problem that's never had a surgical complication. Isn't that amazing, folks? That's a dream for most patients who understand what complications are. This patient had ACDF done. He is from Virginia, traveled to Florida for this procedure. He did not want another ACDF because, let's face it, ACDF has a high complication rate. The complication rate for anterior cervical discectomy and fusion is reported at 48% in the literature. And that's what we are taught by the American Board of Neurological Surgery is the complication rate, and that is the accepted complication rate, 48%. Complications include trouble swallowing, hoarseness, aspiration, pain. All those things are, many of them are permanent, some of them are temporary, but nobody wants complications from spine surgery. The surgery you're watching today has never had a complication because that's how safe it is. And when it's done properly with a good surgeon, the chance of complication is very small. To give you an idea of why, first of all, we're able to see everything down here, right? You guys are seeing it with me. This right here is the covering on top of the spinal cord and nerve root. So I'm not going to go past that. I'm just going to go up to it. But it's very easy to see. And that's a bone spur right there. You see that bone spur? That rough edge? It looks like rust. That is a bone spur. See how the laser can peel away a bone spur? Just like that. I mean, that is literally, remember, the laser fiber is 0.5 millimeter. So you're talking about a 1/10 of a millimeter. That's how precise this tool is. That's why the laser surgery doesn't have complications. It's so ultra minimally invasive. And it's available here at Deuk Spine Institute. You're not going to find it anywhere else. You can go to all the best hospitals, Mayo Clinic. You can go to Hospital for Special Surgery in New York. You can go to Cedars-Sinai in Los Angeles. But nobody has this technology, Deuk laser disc repair, available. All right, I know we got some questions, so I'm going to take the questions.
This question coming from Lanu on YouTube.
Hello, Lanu. Welcome to our stream.
Saying most people that have C5 and 6 usually have C4 and C5 issues, but not this patient?
Yeah, well, this patient has C6-7 and C5-6, right? Because he's already had the 6-7 fused, and the surgeons were hoping he'd come back and get another fusion. I want you to look right here. We're going to take a moment. You guys see that white? That is called the posterior longitudinal ligament, and there's the other side of it there, and there's a tear in it, and the herniation has escaped through the tear, and it's pushing up against his spinal cord right there. And that's bad. So I'm going to remove it. I may have to open the PLL a little bit more just to look and see and make sure I don't leave anything there. Oh, looks like there's a big herniation there. It's a good thing I did that. Look at that herniation. Here it comes. Wow. Bam. This is like the Olympics of spine surgery. I say that because I was watching the Olympics last night, and this is truly the best in the world, in my opinion, in terms of treatment. Unfortunately, in America and the rest of the world, surgeons are still recommending fusions. But this is amazing. This is the future of spine surgery happening right here today at Deuk Spine Institute. Pioneered by myself, Dr. Deukmedjian. Peer-reviewed and published many times in the medical literature, completely FDA approved, but you won't find this in your hometown or your city where you live unless you live here in Florida. It's worth traveling for. We have 80% of our patients travel from around the world to have our treatments done because they're not available where they live. There's another piece of herniation, literally sitting on the spinal cord. Look at that. Oh, there it is. It just came out.
We saw that.
It's just incredible. This footage is just amazing. And you only get it if you do endoscopic surgery, okay, which most surgeons don't do. And by the way, the surgery that most of these endoscopic spine surgeons do is not the same. It is highly invasive compared to what you're seeing here. All right, we'll take some questions. We're almost done. I got 5 minutes, Dr. Berndes.
This next one is a comment from Brian on YouTube.
Hi, Brian.
Saying,
Welcome.
you don't mention bone spurs causing compression.
Well, Brian, it's a great question. Bone spurs do form, but they usually don't form where they cause compression of the nerves or the spinal cord. What causes the compression is mostly the herniated disc. The herniated disc is the main cause of compression. Compression never causes neck pain. Compression never causes headaches. Compression never causes arm pain. Arm pain, neck pain, headaches are all due to inflammation. Inflammation has nothing to do with compression. Inflammation and compression are two separate entities. They're like yin and yang. They can never be the same. Man, here's another herniation right on top of the spinal cord. Wow, that's a big one too. That's amazing, huh? I didn't really see this on his MRI. His MRI, this is worse than what the MRI showed. His MRI showed clear evidence of a problem, but it wasn't this bad. This is far worse than I expected. All right, so compression was happening, but it's mostly from the herniation, not from bone spurs. Now, when it is bone spurs, I will zap them away. You'll see me zap bone spurs away. I just did. But you see how small the bone spurs really are and how big the herniations really are. Herniations are much bigger than bone spurs. And more importantly, there's another herniation right there. I'm going to take all this debris out. We're almost done. But the main culprit with spinal stenosis is herniated discs. It is nothing less than herniated discs. Now, there may be some congenital stenosis, meaning the patient is born with narrowing, but that's not symptomatic until they develop acquired stenosis. Acquired stenosis you get from herniations usually, or that can happen from trauma or tumors or infections. But acquired stenosis most commonly is due to herniated discs, by far, which is what we treat with the Deuk laser disc repair. Just about done. This is the last of the herniation. Keep the questions coming.
We have another question from Lanu on YouTube.
Sure.
Asking about figure skating. When I see them fall on solid ice, I always think about herniated discs.
Yeah.
What's your view about skaters' risk?
Well, it's a great question. Fortunately, most of them are very muscular and they fall on their muscles. So their muscles pad them. I know this because I was a muscular guy once and I did skate and I did fall a lot on the ice because I was not very good at skating, certainly not by Olympic standards. But I did fall a lot on ice. I fell a lot on my snowboard. And I can tell you, the more muscle you have, which those skaters have a lot, the more padded you are when you fall. So I'm not too concerned about that. Any other questions?
No current questions, so we do have a comment from Poodle Dog on YouTube.
Poodle Dog.
Yes,
Hi, Poodle Dog.
saying I'm truly grateful that I had this surgery from Dr. Deuk. No doctor in New York City could have done this surgery for me and be successful. Dr. Deuk is the man for the job. God bless him.
Thank you. God bless you. And I'm so thankful that I have you as a patient, you know, all of you, all my patients. I'm truly blessed that I have my patients. You know, I would be nowhere without you guys and gals. But I want everyone to have access to this technology, and no one in the world should have to suffer through laminectomy anymore. No one should have to suffer through microdiscectomy anymore. No one should have to suffer through fusion or spinal cord stimulators anymore. We now have a far better treatment. No one should have to suffer through pain management anymore, which doesn't cure anything and just prolongs the suffering. No one should have to suffer through any of those treatments, and no one should have to suffer through alcoholism to treat their pain, or drug addiction to treat their pain, or suicide to treat their pain. All of these are real consequences of not getting the right treatment for your pain. and we now have the ability to cure pain, we should be doing it. Unfortunately, people don't know about our treatments. And ones that do, many of them can't afford it because their insurance may not cover the procedure. So we need the insurance to cover it. By the way, look here. Henry, can you see this?
Yes, we
All
can.
this little blue stuff. Can you guys see all the little blue things here?
Yes, we can.
These are all pieces of herniation. There's more here. Look at this. Look at all this. Can you guys see all this?
Yes, we can.
Those are all pieces of herniation. That's why when I say a herniation's not one piece, it's many pieces. We've got about 50 pieces here. All right, we're going to just put some antibiotics. We've never had an infection with this surgery, ever. And our average amount of relief of neck pain, headaches, arm symptoms is 99% in our patients. That's per the patients, not per the doctor. That's what our patients tell us the result is. So we don't doctor the results. You can see the incision is literally 4 millimeters. I'm going to show that to you in a minute. Let me just break down my suction line. Here's a little ruler for you. It is sterile. Look at that incision, folks. Guys see this?
Yes, we do.
It's literally 4 millimeters wide. And we've completed our first drop of blood for the surgery and our last. You good? Let me hold it while you finish up. Any other questions?
No current questions.
Thanks for joining us. Let's leave the audience with a video about the how Deuk laser disc repair for the cervical spine compares to other treatments that other doctors offer that are far inferior, in my opinion.
I'm Dr. Deukmedjian, CEO and founder of the Deuk Spine Institute. I'm here to talk to you today about neck pain and its common treatments. Neck pain has different causes. The most common cause of neck pain is a herniated disc. Herniated discs account for about 85% of chronic neck pain. The second most common cause of neck pain that's chronic is the facet joints. There are facet joints on both sides of the spine, left and right. There is one facet joint for every disc. Facet joint pain requires a different kind of treatment targeted at the facet joint itself. For disc pain, which accounts for 85% of neck pain, the best treatment in the world is the Deuk laser disc repair. It is the most advanced treatment that is the safest and has the highest chance of successfully eliminating symptoms. Let's talk for a moment about what's important for patients who are considering treatment for neck pain coming from an injured or damaged disc in their spine. The most important thing for patients, number one, is getting rid of their symptoms. The type of symptoms that disc herniations or disc injuries can cause include neck pain, headaches, and symptoms down the arm, such as weakness, numbness, tingling, or even pain shooting from the neck down into the arm. The symptoms of neck pain include disc herniations, which are the most common cause, and patients want those symptoms gone. That is their number one priority and goal. The second most important goal for most patients is to avoid a complication from the treatment. Medical treatments do have complications, and the more invasive the treatment, the more likely a complication will occur. Complications from surgery, for example, can include blood clots, pneumonia, heart attack, infection, failure of the spine to heal properly after surgery. There can be implant migration or implant failure, adjacent segment disease, and vascular complications such as injury to the blood vessels or nerves in the neck, including the trachea and esophagus. Nobody wants a complication from spine surgery on their neck, so less invasive is typically going to be a better option to avoid those complications. The third thing patients really want when they're looking at treatment options for curing their neck pain is they want a quick recovery. People want to get back to a normal life as quickly as possible. They want to go back to their activities, they want to be active, they want to play sports, and they want to go back to work. And finally, the next thing to consider is long-term results. For example, if you have a treatment today and it works, how long will that treatment last, and will it create additional problems down the road for you? Treatments like spinal fusion that are invasive typically result in the need for additional treatments such as pain management, physical therapy, and possibly additional surgery. We're going to look at each of these individually and go through each of these options individually. So we're going to start with more invasive treatments that are typically recommended for patients with herniated discs or degenerated discs in their neck. The most common treatment recommended around the world is anterior cervical discectomy and fusion. That is a surgical treatment where the entire disc is removed surgically through a large incision that is very risky. There's bleeding associated and risk of injury to surrounding structures such as the esophagus, trachea, and blood vessels in your neck. Complications are very common with this type of surgery. The complication rate is accepted at 48%, which is a very high number. So if you're considering ACDF or anterior cervical decompression and fusion, you are looking at a very high complication rate. The success rate of this surgery at eliminating neck pain is very low. It's somewhere on the order of 25%. That is the generally accepted success rate at eliminating neck pain. An additional treatment that you can consider is artificial discs. Artificial discs are very similar to ACDF. The difference is instead of fusing two bones together with a metal plate and a cage, we're actually putting in a mobile disc made out of metal and plastic that moves. The problem with the movement is that these discs do pop out of the disc space. Over time, they can fail. They can cause collapse of the vertebral body above and below through fracturing, especially in patients with weak bones such as osteopenia or osteoporosis. Those types of patients are at high risk for complications from both ACDF and artificial discs. Another complication from artificial discs is that you can develop facet joint pain and adjacent segment disease, very common with artificial discs and fusion, and they typically have the same rate of adjacent segment disease. There's also a long recovery associated with both ACDF and artificial discs. Recovery can take months to years, if recovery even happens at all. There's tremendous scarring in the wound associated with ACDF and artificial discs. Lots of scar tissue, lots of pain, and lots of problems after these surgeries that are invasive. Alternative treatment would be to go in the back of the neck and do a cervical laminectomy and fusion. Again, large incision, high chance of complications, very long recovery, taking years to recover. All three of these types of surgeries, ACDF, artificial discs, and posterior cervical laminectomy and fusion, require the use of postoperative narcotic painkillers. Narcotic painkillers are opioids. They are dangerous. People get addicted to them, they can be abused, and people can overdose. It's easy to overdose on narcotics because you want to keep taking them to treat the severe pain you're going to have after these invasive type surgeries. The severe pain can last weeks or even months, and the addiction can happen very quickly. Let's move into less invasive treatments such as epidural steroid injections. This is a treatment commonly recommended by pain management doctors. They stick a needle into your spine and inject the steroid medicine to reduce inflammation. While this treatment can be effective at temporarily giving you relief for a few days or even a few weeks, the pain always comes back from a herniated disc because the source of pain is never being treated. The annular tear and inflammation within the annular tear is not treated by an epidural steroid injection. The steroid goes throughout your body and causes systemic side effects such as high blood pressure, elevated blood sugar. In patients with diabetes, this could put your sugar up into the 300s and 400s, which is very dangerous for patients. So steroids should be avoided as much as possible. Next, let's turn to spinal cord stimulators. The problem with spinal cord stimulators is they are highly invasive and they are frequently put into patients by untrained doctors who are not surgeons. These doctors are typically pain management specialists, and they're putting these stimulators in patients not because they can cure your pain, but because it's another treatment that they have up their sleeves. These treatments with stimulators pay these doctors obscene amounts of money. The profit for the doctor can be in the tens of thousands of dollars. Avoid spinal cord stimulators. They do not work, they're dangerous, they put you at tremendous risk, and in the end, basically you're taking this device, sticking it on top of your spinal cord and putting a pacemaker under your skin that you're gonna have to live with for the rest of your life. They cause scar tissue and they frequently migrate and get out of position. Next, we're going to talk about physical therapy. While physical therapy has many benefits, such as keeping you toned and fit while you're struggling through the pain and trying to stay mobile, but physical therapy will never, ever cure pain in the neck from a herniated disc. It will just try to keep you active and from getting more and more sedentary and developing deconditioning of your muscles because you're sitting around because you have neck pain all the time. Finally, let's talk about the Deuk laser disc repair. The Deuk laser disc repair is the solution for neck pain. If you have a herniated, bulging disc, extruded, ruptured disc, protruded disc, or degenerated disc, the Deuk laser disc repair works by minimally invasive treatment going to the back of the disc where the problem is coming from. This is the tear in the back of the disc that has inflammation, and using a laser that is extremely precise. The laser fiber itself is 0.5 millimeter or half a millimeter wide, and the endoscope allows me to see 1/20th of a millimeter. I can directly see the nerves and spinal cord. It is an extremely safe treatment. As far as results go, the Deuk laser disc repair has the highest success rate of all the treatments we've discussed so far. We have a 99% cure rate of neck pain coming from herniated discs, and the Deuk laser disc repair has 0 surgical complications to date. Our patients have an immediate recovery. In 1 hour, they're leaving our facility and they're going back to their hotel room. They usually drive themselves in the next morning for a quick checkup, and then it's back to a normal life. Well, I've enjoyed talking to you, and thanks for taking the time to listen to our video. I'm Dr. Deukmedjian. We'll also find this on our podcast at Deuk Spine Institute.